How are you doing?
I'm great. I'm great. Thank you.
We need to hear something about what you're doing. I mean, I read up on some of the books you wrote and some of the things you're doing. You're a physician, a doctor, medical doctor, but you also you are more of a you have more of a holistic approach to medicine, right?
Well, first of all, I'm a naturopathic doc, not a medical doctor, just to make sure we're clear on that. And our approach to healthcare, which kind of goes to the topic we're going to talk about, has always been to approach it from the standpoint of informed medical decision making. I mean, what I've heard in my office for 25 years is if I'd known then what I know now, I wouldn't have had this procedure. I wouldn't have taken this drug. I wouldn't have adopted this crazy diet or taken this supplement, or I would have done something sooner about this situation, right? So we really promote the idea that you should make decisions about healthcare the way that you make decisions about buying cars and houses and other important things in your life, where you check things out, you investigate. I mean, of course, emergency is the exception to that rule, but when you're hanging out with doctors, and we want to promote as little of that as possible, you should proceed with caution. And so we've created huge libraries. We have 3,500 hours of educational programming. We have 2,500 articles, referenced articles in our library on everything from how to prevent kidney stones to what you should do when you have stage 4 cancer. And so this whole COVID thing's kind of right in our wheelhouse. What's going on? What should I do? Should I do anything? You know, that kind of thing. That's sort of how we got into analyzing all of this.
Okay, let me just quickly translate this because we don't have a professional translator with us, so we're going to have to make do with what we have. So give me just
Okay.
1 minute. Also Dr. Popper ist Medizinerin, aber sie ist keine Ärztin, sondern sie ist Naturheilkundler. So muss man es wohl übersetzen. Sie glaubt daran, dass viele medizinische Eingriffe gar nicht erforderlich wären, wenn man nur vorher sein Leben richtig gestaltet. Unter anderem geht es da um das richtige Essen. Und sie versucht, Möglichkeiten zu finden, wie man jeweils, wenn ein medizinischer Eingriff erforderlich zu sein scheint, vielleicht doch noch eine andere Möglichkeit finden kann. Okay, well, let's step right in. You know so many things. You have collected so many facts about Corona in your country that you do have a counterpart here in Germany. It's a guy by the name of Dr. Bodo Schiffmann. He's done the same thing. And he's also very polarizing, not personally, but because so many people are out there who seem to want to believe that this is a serious crisis and they do not want to listen to anyone else. Is that the same kind of experience that you have had?
Yeah, it's the same here in the United States. And by the way, we've had this issue for everything that's going on right now has been going on for a long time. It's just going on in a bigger way where things are much more obvious. Okay, so let's think about how people have interacted with medicine. Again, going back to what I was talking about before, you know, the risk that the chance that you're going to be harmed by mammography is 3 to 10 times higher than the chance that you will benefit from it. Yet every country, every westernized country on the planet does billions of dollars a year in mammography. People believe it. They believe it. All right. There's no science to support it, but they believe it. The same thing for PSA testing. The same thing for prescribing statin drugs for cholesterol. So we have conditioned, the collective, we have conditioned the public to digest and act on false medical information for decades. And so this isn't a shocking thing going on right now. They knew they could do it. The people behind this knew that they could do it because if you can, in the United States, healthcare is a $3.5 trillion business annually. So if you can sell $3.5 trillion worth of nonsense to the public every year, you can certainly sell this to the public one time. Easy, right? They knew it. And so I don't think it's going to work out in the end for them. I really don't, or I would have just gone to Sweden a long time ago and forgotten all about it. But the bottom line is you're just watching what has always been going on. False stories about healthcare, acting on that costs trillions of dollars every year. And this is maybe the opportunity for a great reset, because in the end, I think everybody will know this was a hoax. It was a planned thing and that sort of thing. So that's what I think about it.
Yeah. Also sie sagt, dass in sehr vielen Fällen die Amerikaner bisher an falsche Informationen geglaubt haben und dass zum Beispiel, eins der Beispiele ist die Mammographie, dass inzwischen bekannt sei, dass die Mammographie selbst wahrscheinlich gefährlicher ist als das, was damit eigentlich verhindert werden soll, jedenfalls hohe Risiken darstellt. Und weil die Öffentlichkeit so gläubig ist und solchen falschen Informationen glaubt, sei es auch hier bei Corona gewesen, die öffentliche Meinung so weit zu drehen, dass sehr viele offenbar, ich will mal wissen, wie viel genau, jetzt auf Linie gebracht sind und glauben, dass es ein hochgefährlicher Zustand ist. Sie glaubt aber am Ende, dass das nicht funktionieren wird, sondern dass der als Hoax, als Täuschung, dass das alles enttarnt wird. So you are optimistic.
I am, and I'll tell you why I am. So, you know, there's a thing. There are a couple things going on. The first thing, you probably have heard, the best laid plans of mice and men often go astray. That's an American saying, but the other thing is that they're starting to make big mistakes, and things haven't gone as planned. So the first thing is that when this all started, what was supposed to happen was all countries were going to have the same response. And so when Sweden and Japan and a few other countries decided not to play the game, this is really a problem. In fact, I'm making a video today, which I'll post next week, about the Swedish data, because everybody's being told that Sweden's in trouble. They're not. The real data are very concerning to the powers that be right now, because it shows that all this was nonsense. So that was the first thing that went wrong. The second thing that went wrong is that we were supposed to have a different president when this happened. And the president was supposed to take our best doctor's advice. I don't even call him Dr. Fauci anymore. He's a feckless nitwit, in my opinion. But they were supposed to take Fauci's advice and lock down the country for 17 months, but that didn't happen. So you have this sporadic, like different states doing different things over here. And that's created a problem, because in states where there's literally been nothing done, they're fine. In states where the lockdowns have been severe, that's where they claim the outbreaks are severe. Our own governor, who we call the Emperor of Ohio, yesterday was diagnosed with a positive test and a negative test all within a half hour. Okay, so I mean, this is not good for them, right? So that's a big problem. The third problem that they're having is that there is so much media attention right now, alternative media, albeit it's not being covered so much on the mainstream news, but this vaccine that they want to promote is dangerous. And right now, it's estimated that about 40% of Americans will agree to have it, even when presented with the idea that the only way you can go to a sporting event or the movies is if you agree to have it. Less than half the population says they're going to do it. The reason why we have so many people who bought into it, generations of people dumbed down by public education, well, half the country's not sending their kids to school, not because of the virus, by the way, but because of the stupid draconian crap that they're doing in the schools. So this is a problem. And then, of course, the vaccine mandates that they already got promoted in some of the states. If you don't send your kids to school, you don't have to worry about that anymore. So vaccine uptake has been going down, 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 down. It's now below 75%. They were apoplectic when it was just over 90%. So you got to imagine the way that they are right now. I mean, they're just hysterical about this. And in our newspaper every week is some pediatrician pleading with the public, please take your children to the doctor. They've got to get caught up on their vaccines. So things are not going well. I could tell you some more things that they're concerned about, but I don't think that they're having champagne tonight and thinking about what a great success this is all going to be in the end at this moment in time. And that's very good for our side.
Also sie sagt, sie ist optimistisch, dass das Ganze als Täuschung auffliegen wird, weil zu viel schief geht. Insbesondere heute Morgen, da wollte ich Sie sowieso nachfragen, gab es einen Vorfall, also gestern Abend bei denen gab es einen Vorfall mit dem Gouverneur von Ohio. Der ist innerhalb von einer halben Stunde positiv und dann negativ getestet worden. Auch die Zustimmung zu Impfungen scheint doch deutlich zu sinken, sodass diejenigen, die die Maßnahmen vorantreiben, inzwischen ein wenig enttäuscht sein sollten, jedenfalls keine Champagnerkorken knallen lassen sollten. I read about this incident in today's edition of the New York Times about your governor in Ohio, Mike DeWine. How he had been driving on I-75 towards Cleveland in order to meet with President Trump, and then he was informed that he was tested positive on that very same morning. Then he turned around and drove back, had another test, and it turns out he's negative. Now, there's two types of tests they're talking about on the New York Times. One is the antigen test, and the other one is the PCR test. What do you think about these tests?
Well, the tests are inaccurate. And the one test, the PCR test, the inventor of the test said it should never be used for any type of diagnostic procedure. But this is another area where they've screwed up, because what was supposed to happen, I think, based on what we've seen, is after flu season is over, they were going to drum up cases by knocking on doors. Like how we're getting all these cases in Ohio is our emperor has dispatched a group of a few hundred people who knock on doors in neighborhoods and random test people. And then using the fake tests, you get a certain number of positives. And then he gets on TV every day and says, oh my gosh, we've got 12 million people in Ohio and 150 people have the flu, so you have to stay home now. Wear a mask, right? So that's all good, because there are a certain number of people that are willing to buy this load of crap. I mean, again, you have to have a lot of stupid people to make this work. And I don't use those terms lightly, but we have a lot of stupid people in this country that say 150 people have the flu. We better all stay home. I'm going to the basement with my mask. So this is a level of stupidity that I don't even know how to explain, but that's what we have. All right, so this would have gone pretty well because there are stupid people buying it, except that they overplayed their hand. They went nuts with the testing. And then what started happening is some things that even the media could not ignore, because the media has been pretty obedient. So we had an episode in Florida that was just hysterical. I mean, I don't remember how many labs it was. It was like 18 or 20 labs. And what happened was, I'm going to just get rid of this here. What happened was that they all reported on one day that 100% of all of the tests came back positive. That's statistically impossible. Yeah. And then right within that same period of time, a nursing home in Connecticut had 18 residents who tested positive, and they had symptoms. So they took them all to the hospital. And as soon as they got to the hospital, they tested them again, and they were negative. And then they stayed in the hospital so they felt better, and they took them back to the nursing home when they felt better, and then they all tested positive. Okay, so the bottom line is this is statistically impossible. So, and you have this kind of thing going on, and you also have a bunch of people, a growing group of people who are saying, I went to get the test, the lines were long, they closed the public restrooms. These are great moments in public health where you don't allow people to use public restrooms anymore. So they left, right? And then they find out that they get a test and test results in the mail and they're positive. So when you're positive and you never got tested, that's interesting. Well, one governor who is not compromised in Florida has actually opened an investigation of that and is working on accumulating data. And we're accumulating those cases too. And we get some every day where people are saying, here's the thing, I can prove that I wasn't there. I was actually doing something else, or you can see on my cell phone that I was in a different location. I never had the test. So this is, the tests are incorrect. And the ramped up testing was a miscalculation on the part of the people doing this, because these stories are starting to come out. And that's even causing some stupid sheep to say something is wrong. Mm-hmm. And that's not good. When the sheep start turning around, this is not good for them either.
Also sie erzählt, dass diese Tests ganz offensichtlich weder der eine noch der andere wirklich funktionieren. Ein Beispiel in Florida, wo die Testreihen, die durchgeführt wurden, zu 100% positiv rauskamen, was statistisch unmöglich ist. Ein anderes Beispiel in Altersheimen, wo die Leute erst positiv und dann negativ getestet wurden. Und das würde inzwischen so weit gehen, dass sogar die Leute, die eigentlich bis dahin als Schafe, sie sagt, da gibt es leider eine Menge Leute, die sehr dumm sind und deshalb alles mitmachen, aber sogar eine Menge Leute, die eigentlich als Schafe bis dahin alles mitgemacht haben, werden jetzt langsam nervös. Und das wiederum macht die Leute nervös, die in der Verantwortung ist. One question, the New York Times is one of the most, supposedly one of the best newspapers in the world. In this article about your governor, there's this paragraph. It says, experts are increasingly arguing that the best chance to catch the most outbreaks is through large numbers of less accurate tests. Does that make any sense? I mean, I don't understand this.
This is where the stupidity just reaches unbelievable heights. First of all, about the New York Times, this is a newspaper that is so grossly inadequate and inaccurate that if they reported this morning that it was Friday, I would run to my calendar just to make sure. I'd be very concerned about even that. You know, if they said the sun's shining outside, I would go look out the window. So they lie when the truth fits better. But just on its face, you know, the best way to deal with this is larger use of inaccurate tests. This is good. Okay, I mean, you can't make this stuff up. It's amazing.
I was thinking that maybe there's a logic behind this, but apparently you don't think so either.
No, I think what it is it's a theater of the absurd.
Uh-huh.
And the only thing that we can hope is that even some of the people who bought this, and I think this is going on, by the way, there are, when you look at the group of people who bought this whole story, there are some who are unsalvageable. I mean, these are people that I think even after it's over, if the New York Times ran a headline saying it's a hoax, they would say, oh, no, I'm staying in the basement with my mask on. Okay, so we don't have anything we can do for those people. But there is a group in the middle who in the beginning thought that there was really something to be concerned about. And I get emails from some of them every day. And I just got one from a medical doctor this morning who said, I heard you talking about this and I wrote you off as a conspiracy theorist, but the longer this goes on, the more I start to see that there is absolutely no logical explanation for any of this. And I see what you're saying. And that this is, again, where the despots behind this have really made a grievous error, because when you start losing the people who believed you in the beginning, it starts to be over, So. So that's a ridiculous statement. The New York Times, that's trying to help the cause here, trying to gin up the fear, they're even starting to get sloppy about their reporting, because somebody might actually look at that and go, what?
Ja, right? That's what happened to me this morning. I thought I was missing something. Also sie sagt, die New York Times ist nicht das Maß aller Dinge. Sie würde der New York Times nicht trauen. Wenn die sagen, heute ist Freitag, würde sie lieber auf den Kalender gucken. Wenn die sagen, die Sonne scheint gerade, würde sie lieber rausgucken, ob das stimmt. Und sie sagt, dieses Theater des Absurden führt dazu, dass auch die Mitte, die es gibt, die am Anfang vielleicht Bedenken hatten, aber jetzt immer mehr Fragen stellen, dass die jetzt noch mehr Fragen stellen. Eine bestimmte Gruppe, die sitzt unten in ihrem Keller und die ist sowieso unten nicht rettbar, sagt sie, die haben ihre Masken auf und werden die nie wieder absetzen. Aber die große Mitte, there's a great, apparently, according to what you think, there's a large group of people within the population who were suspicious or not suspicious in the beginning. They were thinking, well, maybe it is dangerous. But in the meantime, with all these mistakes that are being made, they're becoming more and more suspicious of the official activities. And that's the group that you think will turn the tide, more or less.
I think so. And again, not that my email is the microcosm of the world, but when this all started, within a real short period of time back in March, I was getting 3,500 emails a day. And I would say that probably half of them were people who said, I see there's something wrong here. And half of them were people who didn't agree, right? Mm-hmm. Today, the email volume has gone up. It's thousands and thousands and thousands a week now. Mm-hmm. And last week I got three, not 3%, three people who don't think that I'm saying the right thing. And by the way, to kind of emphasize the importance of being informed, we've only had, since this started, we have members in 33 countries. And in the entire time, we've had three people of our paying clients who we've trained how to look at medicine differently. We've only had 3 people who decided to disengage with us because of my stance on this. Mm-hmm. So when you're informed, this becomes really evident from the get-go. Okay, so 3 out of our huge network is a pretty good number, and those were all in April. We haven't had a single member since April who's decided to call and complain about my stance on this. So I think the tide is turning. And I'll tell you another thing, too. They really miscalculated on the school issue, because it's one thing to do some of this crazy stuff that they're doing with testing in adults and quarantines and all that kind of stuff. But when you start impacting children, this month in August, some schools decided to open early, the ones that were going to open, because they missed so much back in the spring. Already we're getting another wave of people homeschooling because they send their kids to school. The children come home, they're crying. They don't understand why they have to wear a mask. They don't understand why they get in trouble because they want to sit close to their friends, or, it's just a draconian, terrible environment. Well, when you start hurting people's children, you generate a whole different response than when you're just talking about inconvenience. A lot of people looked at this as, people are just inconvenienced because they can't open their stores right now. Well, it's not inconvenient. Going broke and bankrupt is not inconvenience. But the point is, this is a different level of problem when your own children are hysterical over this, and you're saying, how can little kids be punished for wanting to be close to each other or share their crayons, right? I mean, this is crazy.
Sie sagt, sie hat am Anfang schon einige tausend Mails immer gekriegt. Jetzt kriegt sie täglich Tausende von Mails. Am Anfang gab es noch ein paar Leute, die gesagt haben, hey, das stimmt doch alles gar nicht. Und jetzt hat sie zuletzt nur noch 3 Mails gekriegt, die sich abwenden und beziehungsweise die aus ihrem Kanal aussteigen. 3 Mails von Tausenden, sonst nichts mehr. Und das, sie sagt, das, was wirklich die Stimmung zu drehen scheint, sind die Kinder, the children. Wenn die unter Druck geraten, wenn die anfangen zu weinen, warum muss ich eine Maske tragen, das haben wir hier in unserer Sitzung auch gehabt, dann dreht sich was in der Bevölkerung und das scheint jetzt gerade der Fall zu sein. Ja.
So, you know, we're in touch with the group of scientists and attorneys at law in Holland, in the Netherlands, and they have a research, was heißt eine Marktforschungsfirma?
Market research.
Market research, or like, you know, like a company that does polls and, you know, that works with them, sort of does independent polls. And what's interesting, they found that like 30% of it was a representative study, and 30% of the people they asked were already convinced that, you know, the whole measurements and whatever has to be done and over with like yesterday. So they really didn't want to have anything to do with it anymore. And then there were like maybe 20% who were interested in like wearing a mask in their bed alone, you know, like really obsessive. And 50% were really on the edge. So basically anything, if a few of the things, you know, what you said, if there's a little bit more added to the whole theater, basically, or like this whole procedure, like with the children, what you said, like what's starting here as well, that, you know, they're supposed to wear masks like during the lectures in the school. So if a little bit more of that might be added, or like forced vaccination or something, that could just, you know, get them off the fence, and then they're convinced that, you know, it has to end.
Well, and the problem that you have, that the criminals running our governments right now have, is that if you get to the place where 50 or 60% of the population doesn't agree with it anymore, what you can have is there are a couple of ways that it can go. You know, we have state militias that are organizing. We may end up with a civil war here. That's one way it could go. Another way it could go is civil disobedience that you can't control anymore. In other words, I live in a county where there are 2 million people in the general area where I live. So just think about what would happen if 1 million people walked out the door tomorrow and said, we're not doing this anymore. We're just not going to do it. I'm opening my restaurant. There's not going to be any social distancing. I'm opening my business. We're not going to deal. We're just not doing it. What do you do to punish 1 million people? You can't. Okay. And if it was, there are 11.6 million people in Ohio, the state that I live in. If 3 million out of the whole bunch just said, we're done, we're just not doing it, there's no choice. They have no choice but to just go away, because there's no place to put 3 million people. There's no way to arrest them. There's no, and the other thing too is they've alienated the law enforcement. The same people behind this have really alienated law enforcement. So most of the sheriffs in the state I live in have publicly stated, they're so against this stuff that they've actually held press conferences and said, we don't want anything to do with this. We're not going to enforce it. I don't want to hear about a business being open illegally. One guy said if the health department wants to enforce the mask thing, they can put little yellow lights on their cars and drive around the county and do it themselves. Don't call me. All right. Yeah. So there's a civil disobedience that could be very peaceful. I would prefer that to a civil war, but I really don't care which way it goes at this point, I have to tell you. But there's a civil disobedience thing that could happen. And in my book, I actually write about that maybe just everybody will walk out the front door very soon and say, I'm done with this. And then we're done with this. This is only being done because people are consenting to it. It's not because people want to do it entirely.
Yeah, that's what it looks like. If there wasn't any obedience, it wouldn't have come this far. Let me just quickly translate. Right. Also, Kollegin hat gerade erzählt, dass wir ja auch zusammenarbeiten mit den Holländern und dass die eine Studie durchgeführt haben, eine repräsentative Studie. Und danach sind, wenn ich die Zahlen jetzt richtig habe, Viviane, 20% vollkommen gegen alles, was hier angeordnet, 30% sogar dagegen, aber 20% machen alles mit und 50% sind on the edge und die würden sagen, wenn man uns ein bisschen besser überzeugt, dann sind wir auf der anderen Seite. Dr. Popper sagt dazu, das ist genau das Problem. Je mehr Informationen rauskommen, desto mehr Leute wenden sich von der regierungskonformen Linie ab. Und sie befürchtet sogar, dass die Amerikaner, die ja über sehr viele Waffen verfügen, by the way, over the last 3 or 4 months, more guns were sold than ever before. That's even in the German news. So, sie sagt also, das kann leicht in einen Bürgerkrieg ausarten. Es sind noch nie so viele Waffen verkauft wie vorher. Aber bei ihr, in ihrem County von 2 Millionen, da gibt es immerhin inzwischen im Law Enforcement-Bereich, also Polizei, eine Menge Leute, die einfach nicht mehr mitmachen, sondern sagen, wenn ihr die Bürger unter Kontrolle bringen wollt, dann macht das selber. Sogar ein paar Sheriffs haben sich hingestellt und gesagt, das ist es, wir machen nicht mehr mit. Do you know, two things really frightened the Germans and made them do as they were told. One is the pictures from Bergamo in Italy, and the other one is those pictures of what happened in New York. Do you know anything about what really happened in New York?
Well, what happened in New York is a couple of things I'll say about that. The first thing is there is a nurse who ended up, she's a travel nurse, who ended up spending some time in one of the hospitals that was very supposedly overcrowded and all that sort of thing. And she said that the patients were being handled inappropriately, and she started filming everything. They didn't know it, but she started filming everything, and she's got actual footage of being told to do things that shouldn't have been done, like putting sick, infected patients in the same room with ones that weren't, so they had created a bigger problem. It's well known that part of the epidemic was because the governor ordered people who were still contagious to be taken back to nursing homes and exposed to the population that's the most vulnerable. And that was extraordinarily inappropriate. We think that the governor of New York actually killed a few thousand people through that alone. But the thing that I can't figure out, and it'll take a long time for this all to be figured out, but if you take a look at what was going on, according to the governor of New York, there were hospitals in parts of New York that were so overcrowded that they had to put people in parking lots. Okay, remember the whole business of tents and parking lots. We have firsthand accounts of people who were in those neighborhoods and said that never happened. That's the first thing. I mean, I've got affidavits from people who say it never happened. The second thing is that the president put a boat in New York Harbor with 1,000 beds in it. Those beds were never used. 79 people was the maximum that they had on the boat. Now, you would think that before you would put people in a parking lot, you would take them to a hospital boat. Yeah. There were hospitals closed all over the cities. So you would think that before you would put people in the parking lot, you would open up a nearby hospital that was equipped. They built temporary hospitals all over the city. And according to a very well-documented researched story on NPR, most of the beds were not used. So, I mean, I just don't know how you reconcile, we will put people in tents in parking lots with people who say, I was there and there were not any people in tents in parking lots, and the fact that there were hospital beds available all over the city. That's why they closed the hospitals, is to make sure that nothing was happening except care for COVID patients. So I tend to think I think that the part of killing the senior citizens by putting them back in the nursing homes, I think that was a true account. I don't think this business of overloaded hospitals actually happened in quite the way that they reported. And by the way, the same thing is going on. We've caught, you talked about the footage from Italy being used in different countries. Well, there was one news story where this was supposedly Arizona in the summertime. And it was to show you how terrible things were in Arizona in the summertime, except that the trees had no leaves on them. Well, in the summertime in Arizona, the trees are not barren, so that picture had to come from someplace else. We don't know exactly where it was, but they must have used the pictures from, and again, this is the carelessness, and a lot of people are not looking at these pictures as carefully as you and I are, but sooner or later, somebody's going to look at that picture online. It's still there, by the way, you can see it and say, this is really weird because Arizona doesn't look like this in the summertime, can't be accurate. Must be from someplace else.
Also sie sagt, die Situation in New York wird offensichtlich in den Mainstream-Medien falsch beschrieben. Sie hat eine Menge Zeugenaussagen, die sagen, das stimmt so nicht. Die Zelte, die da standen, die seien gar nicht belegt worden mit den Patienten, die man in den Krankenhäusern nicht mehr unterbringen konnte. Viele Krankenhäuser seien sogar leer gewesen. Außerdem sei es ja offensichtlich, dass wenn da ein Hospital-Schiff draußen steht mit über 1000 Betten, dann würde man die Leute ja nicht in irgendwelche Parkplätze packen, sondern dann würde man die in das Schiff packen. Da sind aber nur 78 Leute gewesen. Eine Krankenschwester, I think the nurse's name is Erin Olszewski, something like that. Ja, yes. Eine Reisekrankenschwester, die extra da hochgefahren ist, um den Leuten in New York zu helfen, sagte, dass ganz viele Patienten völlig falsch behandelt werden würden. Die hat darüber auch ein Video gedreht und jetzt ist sie weg. Do you know what happened to her? She's not really, nobody can reach her anymore.
I don't know what happened to her. The last time I saw her was on a news show, and she was having a book come out. And I haven't, frankly, had the time to check to see if her book is out yet. So I don't know what happened to her. But it's very difficult to get mainstream attention. Like most people in the United States don't know who I am, even though I'm one of the most outspoken people about this. And the reason is because there's no mainstream coverage of what I'm doing. So she could be just not getting coverage from anybody right now, or maybe something else has happened. I don't know.
But there are other medical experts, scientific experts like John Ioannidis and what's his name, Michael Levitt.
Dr. Atlas.
I mean,
yeah,
Michael Levitt, the former Nobel Prize winner in chemistry, I think. They're at Stanford University, and they too have adopted a position of, listen, you got to take this with a grain of salt. It's not as dangerous as everybody claims it is. And I think John Ioannidis published a study in March or so in which he says the mortality rate is far lower than what everybody thinks. Why are these people not getting any attention from them, or very little attention from the mainstream media? Is that going to change?
No, it's not going to change. It won't change until the hoax is exposed. And we're working on something that I can't really tell you much about right now that will probably result in that happening. But when the hoax is exposed, then everybody will want to cover it because it'll be too big to ignore. Yeah. And then maybe those people will get some coverage. But right now, in order to perpetuate this, it's very important that people not hear a dissenting story. Now, this is another area where they're starting to screw up. So you probably have heard about this movie, Plandemic, with Judy Mikovits, right? Okay, so the first thing they did was ban it, all right? So that was supposed to get the problem out of the way. Well, what happened? Everybody gets really interested in something that's been banned. You got to go see what the fuss is, right? That film has been seen 1 billion, with a B, 1 billion times. This was a miscalculation on their part, and they just did it again. And so people, you might have seen that a group of doctors, one of whom was an associate of ours, we're so proud of him, David Calderwood, but a group of these doctors went to the Supreme Court building in the United States Capitol, Washington, D.C., and they held a press conference, and they talked about the use of hydroxychloroquine, it's a cheap drug. It's been on the market for 65 years, and it will prevent and treat coronaviruses, all right, COVID-19. Okay, so same thing happened. 17 million people saw this video, and then they took it down. And people said, oh my gosh, this is terrible. I said, no. This is going to be a beautiful, beautiful thing, because what you're going to see, everybody's going to want to know what the fuss is, right? So that's exactly what's happened. This film has been posted in so many different places, and more people are probably seeing it than would have if they'd left it alone. And if our nitwit head doctor, Fauci, we call him Feckless Fauci, if he had actually gotten on television and done something smart, which he doesn't seem to be capable of doing it, thank God, because now it's helping us. But if he had said, listen, there's always people in the medical profession, that some lunatic fringe that will say something like this, but we got to stay focused on the right thing. If he had just dismissed it but left it there, people would have not paid as much attention to it. So this is what I'm saying, where they're starting to make some incredibly good mistakes that favor us. So I think that this will be a good thing. But yeah, they're trying to censor what everybody has to say, and that's worked up to a certain extent. But when you take a look at, even with the taking stuff off of social media, there's still quite a bit of viewership, and that's not good for them, but very good for us.
Sie erklärt, dass ich habe gefragt, warum nicht.
May I have a question too?
Yeah, we can hear you.
Hello, I'm Wolfgang. Hello. And I have a question which is about the possibility of collecting genetical data when you take this swab. It's the same technique to take it as if you make a PCR. And I know that in China they have millions of people taking swabs, millions of people, and sequencing their genome. And I have seen that many of the firms offering PCR tests in the same time are offering this genetic testing, and they do both. And they are private firms. And there is no transparency what they do with the swabs. And there's a big program, international program, collecting genomes. And there's a very big interest of pharma industry to get as many genomes as possible. And I think this is a matter we should observe, and we should question too. What do they do with the data? What do they do with the swabs? Where do they land? Are there some people who are using them, have a double use for those tests? And this could a little bit an explanation why they want to make so many tests, but it's such a nonsense what they do with testing. They try to make us afraid, to rise fear on one hand. But on the other hand, it may be also the interest to have some information about the genomes of as many people as possible.
I think that's quite possible, and I think that that's something that when we get out from under the tyranny, we have to take a very serious look at taking action. Here in the United States, we have a different little bit. I don't know. Maybe you have this in Germany and European countries, but we have the HIPAA laws, which are privacy laws. And what this means is that I'm entitled to keep private all of my medical information. It is only with strict permission that it can be shared with somebody else. Now, we take this very seriously in our office. So, for example, let's say that you're talking with one of our nurses about your health, and then you decide that you want to join a therapy group with one of our therapists. Okay, so for the nurse and the therapist to talk, we have to get permission from the patient that it's okay for them to have a conversation about you. And we really document this because the consequences are very severe if you don't do this, all right? So all these people taking tests, okay, including the people knocking on doors who are not health professionals and all that sort of thing. And then where is this information going, to your point, okay? This is a huge violation of the HIPAA laws. And I think that some very good lawyers in the United States will be filing lawsuits. I know the lawyer that we're working with is looking at the first lawsuit we're going to file very soon. Is going to be very important, but he's a young guy, and he's thinking that his entire career will be devoted to filing the lawsuits that come after the COVID mess starts to subside a little bit to get rights back for patients, because I don't know about you, but I don't want my DNA being shared with anybody. And except for with strict permission. Like if you approached me for a clinical trial of some sort and I gave you permission, that's one thing. But to have it go someplace, to have some company either in the United States or China have it, I would not sign up for that.
Yes, I have
Wolfgang, wir müssen übersetzen zwischendrin.
Have to translate.
I have to translate, Wolfgang, warte. Also, Dr. Wodak hat gefragt, was ist eigentlich mit der Frage des Genmaterials, was ja durch diese Swabs mitgesammelt wird. Es wird ja nicht nur zum Testen eingesetzt, sondern gleichzeitig kann man damit das Genom mitnehmen und hat dann praktisch alle Informationen über die Person, die da gerade den Swab gehabt hat. Wird sowas überprüft? In China jedenfalls wird daraus gerade ein großer Markt gemacht, sagt Dr. Wodak. Und da sagt Pam Popper, ja, das ist in der Tat ein Riesenproblem, aber in den USA würden diese Privacy Laws sehr, 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 sehr befolgt. Und man würde schon darauf achten, dass solche Sachen gerade überhaupt nicht geteilt werden. Sie in ihrer Praxis sorgt dafür, dass sogar wenn eine Krankenschwester mit einem Therapeuten gemeinsam ein einen Patienten behandeln, die Informationen darüber nur ausgetauscht werden dürfen zwischen diesen beiden Mitarbeitern ihrer Praxis, wenn der Patient einwilligt. Und sie sagt, ich würde auf gar keinen Fall jemals zustimmen, und ich vermute mal, dass das die Meinung der überwiegenden Mehrheit der Amerikaner ist, ich würde auf gar keinen Fall zustimmen, wenn jemand mein Genom nimmt und das versucht in irgendeiner Weise zu verwenden. The big question is, how do you control this, though? What can you do? You're saying that there's a lawyer out there who is planning to file a bunch of lawsuits when this whole thing kind of dies down a little. But what are people doing right now? Is anybody filing any lawsuits, for example, when it comes to the masks or?
There are thousands of them.
Oh,
there
really?
are thousands of lawsuits being filed in the United States right now, and we're filing this month. We're going to file one this month, a big one, in federal court. So the lawsuits have already started. I think the key is that one of the things that I caution people who are activists about is to make sure that what you're doing is effective and that you're not just being busy. All right. There's a lot of busy work going on. And I'll tell you what I think. I mean, I want to be supportive of anybody who's trying to do something, but I have 24 hours in a day, and we have to use them in a targeted way. And if you spread your energy just like dissipate it into the wind, nothing will happen. So you've got people circulating petitions. Do you really think that the criminals running our government are going to say, oh, a petition with 1 million signatures? Okay, well, let the people go now, right? I mean, this is just a waste of time. And some of the lawsuits that are being filed are well-intentioned, but it's like swatting at flies when the kitchen door is still open, right? You kill a fly and 7 more come in. So I think it's really important that we target, and the target right now for best lawsuits, in my opinion, are the ones that go to the fact that is this action that is being taken by government justified? In other words, we have to get people their freedom back. This is important because the consequences, and I don't think people talk about this enough in a big sense, but right now what we're looking at is a Holocaust. It is a Holocaust. We killed 11 million people in World War II. That's how many people died. We have more than that now, from suicides and overdoses and older people in nursing homes who are dying from loneliness and lack of human contact and people who are not getting medical care and on and on. I mean, we now are going to surpass the number of people who died in the Holocaust. So the issue right now, in my opinion, that we all need to get focused on is we've got to stop the carnage at this point. That's what we have to stop. And then we'll sort all the rest of this out. I'm concerned about somebody's DNA going someplace it shouldn't go right now. And if you want to avoid that, don't get tested. You are not required to be tested, and even your employer cannot require you to be tested. In the United States, the government's already issued a statement. Now, employers are doing it, but the bottom line is if you took them to court tomorrow, they'd lose. So don't get tested. That's how you keep your DNA from going someplace. But if you're looking at what do I get busy doing, get busy working with organizations who are laser focused on getting rid of these restrictions, because this is what's causing the carnage. It's not COVID that's causing carnage. For every COVID death, even if you want to take their inflated fake deaths or stats, you've got 3 people or more who've been killed as a side effect of this crisis, imaginary crisis that they created. So we've got to get very, very focused on the right things to do at this point.
Also das ist jetzt wichtig, weil die Frage war ja, was kann man machen, um zu verhindern, dass das Genmaterial in irgendeiner Weise verwendet wird? Was kann man überhaupt juristisch machen? Sie sagt, da läuft schon sehr viel, aber man sollte sich hier nicht damit beschäftigen, dass man wie ein Wilder um sich schlägt und alle möglichen Lawsuits startet, die gar keine Chance haben, in diesem Moment jedenfalls, sondern man sollte sich fokussieren, vernetzen und dann die Dinge machen, die wirklich was bringen. Eine Petition, sagt sie, die von 1 Million Leute unterschrieben sind, würde wohl eher nichts bringen, nach ihrer Meinung. Aber es muss jetzt was geschehen, damit so schnell wie möglich der Carnage, sagt sie sogar, also das Töten beendet wird. Denn aus ihrer Sicht sind die Maßnahmen wesentlich tödlicher als das Virus selbst. Inzwischen seien das mehr als 11 Millionen, mehr als das, was im Holocaust passiert ist, weil sich eine Menge Leute umbringen, weil durch die medizinischen Maßnahmen, die nicht durchgeführt werden, Leute sterben und so weiter. Are there any official figures as to the, well, let's call them side effects of these anti-corona measures?
They're starting to come out. In other words, there are some ethical government employees and physicians out there. So, for example, many counties are saying many counties throughout the United States are saying we've had now more overdose deaths than COVID deaths. Mm-hmm. And we keep very good data in the United States to know, like in the month of July, for example, last year, how many overdose deaths did you have in a particular county? So you know if there are more now than before. And it could be attributed to all kinds of things, but the likelihood that all of these counties could be reporting significant spikes in overdose deaths, and it's just all a coincidence with COVID, is probably statistically impossible at this point. The same thing is true with suicides. And even the criminal in charge of the Centers for Disease Control, and I use my terms carefully, these are criminals, came out and said that we now see more teen suicides than death from COVID. Mm-hmm. And he made a strong argument that we should open the schools. And of course, with that, all these draconian measures and the whole nine yards. So the guy's really not talking about anything that's practical to do. But even the Centers for Disease Control is acknowledging the collateral damage.
Mm-hmm. Also die Zahlen, ich habe gefragt, gibt es denn offizielle Zahlen zu diesen Nebenwirkungen in Anführungsstrichen oder vielmehr den Folgen der Maßnahmen? Sie sagt, ja, so ganz langsam kommen die raus. Die Überdosen, die Leute, die durch eine Überdosis sterben, weil sie sich zu viel von irgendwelchen Rauschmitteln geben, das würde man schon deutlich erkennen können von County zu County, was ist letztes Jahr passiert, was ist jetzt passiert. Und das würde so langsam auch vom CDC, von den Disease Controls, also der hauptmedizinischen Wache für diese ganzen Zustände wahrgenommen werden. Die berichten das jetzt auch und auch das scheint dazu zu führen, dass sich die Dinge ändern. I have a home in Northern California and I'm really good friends with with one of the best known consumer protection attorneys. And I spoke with him because I'm really a tort lawyer. And I spoke with him in order to find out, is there a way to hold people responsible and make them pay for this? You know, ask for damages, file a class action suit. And he said, yeah, well, if you can find a product, then you can probably file or ask for a class action suit to be admitted with respect to that defective product. And we've been thinking about the tests, because the tests, even though they work, they don't do what they're supposed to do. That's just like VW selling their cars. You can drive them, but of course they are not really, or were not really, didn't really comply with the Clean Air Act. Have you spoken with any attorneys about that?
Yeah, quite a bit. We've been spending, I think one weekend I spent almost 15 hours in conference calls with groups of attorneys to talk about angles for this. I don't think that the right thing to file is product liability on the tests. Mm-hmm. I think that the right thing to file on the tests is that the working backwards, we have to do all these extreme measures because we have an epidemic. And how do we know we have an epidemic? Because of the tests. But if the tests are faulty, then there is no epidemic, so there's no reason to do this, so let our people go. All right, so I think that's the way to use the tests and present strong evidence that the tests are completely irrelevant at this point in time. The second thing is that how you get the people who did this for criminal liability is proving that they had to know. I mean, that this had to be willful actions. In other words, if ignorance, and by the way, ignorance is not a defense in the United States. In other words, if I didn't know it was illegal to kill people and I killed somebody, I don't get off because I can prove I had no idea. I've been living in a cave for 63 years. Nobody told me it was not okay to kill somebody, so I went out and did it. Well, the fact that you didn't know doesn't exempt you from liability, right? So that's the first thing. And I think the second thing is that they exceeded their authority. In other words, part of what I think has to be done is we have to start looking at what is the definition of a health emergency? Who gets to decide that? How long can a person decide that before there has to be some kind of oversight? And then how do we figure out what the appropriate measures are? Because here in the United States, let's say that Fauci is gone. We think about that often. I'd like to see him gone to prison, but wherever it is that we get him off to, and another criminal takes his spot, which is not out of the realm of possibility. We have a lot of criminals in our government here. And this criminal decides in 2 years that we have people dying in car accidents, and it's spiked a little bit, and we can't have this anymore. So until we figure out a way for there not only to be no deaths from driving cars, but no accidents from driving cars, you're forbidden to drive your car. That could happen. That's no more outlandish than what's going on right now. Okay, so who could that person do it? Is it okay for somebody to do that? If so, for how long could that person declare the emergency? What kind of oversight can one unelected person make decisions like this? So I think that these are questions that are going to be dealt with in the court system for a long, long time. But getting to your point about personal liability, I look at the Emperor of Ohio. Again, we don't refer to them as governors anymore because what our guy did, just to let you know, he said publicly, if anybody in the legislature tries to, rein in my power, I'll just veto the bill, which he does. And then if you ask him for information, he says, I don't have to provide it. So without any documentation or oversight, he just is doing anything he wants. That was probably not the best move for him to make because that's so outlandish that will probably create problems for him. But the issue will be, look at all this collateral damage. He can't hide behind the Centers for Disease Control told me to do it because I don't know if you have these kinds of sayings in your country, but when I was a kid and I wanted to do what all the other kids were doing, and my parents used to say, you don't want to be like the other kids. Like if they all started jumping off a building, would you jump off a building too? Thinking for yourself was something that was valued. So it's going to be very difficult for these people to say, yeah, I did all this stuff that made no sense at all, but somebody told me to do it. So what was I supposed to do? I just did it, right? I mean, it's an indefensible stance that these people will have to take.
Sie fasst zusammen, dass aus ihrer Sicht, sie hat mit sehr vielen Anwälten auch gesprochen, dass aus ihrer Sicht das Wichtigste ist, dass man jetzt erstmal dafür sorgt, die Tests, die im Zentrum stehen, dass man dafür sorgt, dass klar wird, dass die Tests nichts taugen. Und wenn die Tests nicht taugen, dann notwendigerweise würden auch die Maßnahmen zurückgefahren werden. Sie spricht sehr, sehr deutlich von den Criminals in der Regierung. Auch ihr eigener Gouverneur, sagt sie, der benimmt sich wie ein Kaiser, der macht, was er will, setzt sich über alle Regeln hinweg und sagt, wenn ich hier eine Regelung habe, die mir nicht passt, dann werde ich einfach ein Veto dagegen einlegen. Sie sagt aber, nachdem das Ganze durch sein wird, werden sich wahrscheinlich für lange, lange Jahre sehr, sehr viele Rechtsstreite anschließen und dann hoffentlich das, was hier an absurden Dingen passiert, verhindern. Denn als Beispiel sagt sie, wenn jetzt jemand kommen würde und sagen würde, das Fahren eines Autos ist gefährlich, weil es tötet ja Leute, dann könnte er damit mit dieser Begründung das Autofahren verbieten. Solange bis weniger Leute sterben oder noch nur ein zulässiges Maß an Leuten sterben. Und sie sagt, das ist der ganze Wahnsinn, daran sieht man den ganzen Wahnsinn dieser Aktion, dass man, was sie als Kind gelernt hat, nicht unbedingt das mitmachen sollte, was alle anderen machen. Sie sagt, als Kind wurde mir immer gesagt, ich möchte aber genauso sein wie die anderen, wurde gesagt, ja, wenn die jetzt alle die Brücke runterspringen, machst du das dann auch. So, in other words, there is hope at the end there's light at the end of the tunnel.
Oh, I think so. Like I said, if I didn't think so, I would just move to Sweden and get out of here. Really. So yeah, I think that this is a solvable situation, and I think we have to just get it done. I do think that we're reaching the breaking point, which is a good thing. Kind of going to what you were saying earlier about the population is creeping to that place where you get that tipping point of people just won't do it anymore. And I think one of two things is going to happen. It's either going to be a civil war here in the United States, and I would not rule that out at this point in time. It's happened before. Or it's going to be just massive civil disobedience. And there's some of that going on already. I don't know if you saw how much you keep track of some of the stuff in Europe, but we've had some interesting things happen. One week, all the major chain stores, Walmart and Target and CVS, big chain stores, said, we're just going to have nationwide must wear a mask to get in the store, okay? It took 2 days for them to say, never mind. And the reason was the employees didn't want to be in the middle of the whole thing. There was violence. Somebody got killed in Michigan over this mask issue. And so they said, well, we're not doing that anymore. Okay, so that was the government really had a big win for 48 hours on that one. We've seen, if you drive 25 miles outside of Franklin County, where I live, you'll see it doesn't even look like there's a pandemic. Very few people wearing masks, no social distancing going on. The restaurants are full. So just people saying, I'm not doing it. We don't wear masks in our office. We never have. It's required. and we don't. I mean, let them make a scene about it. That would be their worst nightmare. I would be the worst person to pick on, which is, I think, why they don't. And I have never worn a mask, and I have never been denied entry into any store by not wearing a mask in Central Ohio. There are a couple places we stay away from, but generally speaking around here, everybody's just tired of it. People are tired of it, and there will be a tipping point where they'll just say enough already.
That's interesting to hear, because in March, my wife and I took a little road trip with our dogs and went through the states of California, Arizona, Utah, and then back through Nevada to our home. And everybody we met didn't care. Everybody we met said, I don't know anybody who is sick or anybody who has died. And there was one guy, he's a toxicologist in his early 70s, I think. He said, well, he probably got infected by his own son, who's a doctor of medicine, 38 years old. And they infected each other. He says, what it boils down, and his wife is a medical doctor as well. He says, what it boils down to is that this is just the flu. Maybe a different kind of flu, but it's just the flu. Let me just quickly translate this. Also sie sagt, die meisten Menschen in ihrem Staat, in Ohio, in ihrem County, Franklin County, sagen, wir sind sick and tired davon, wir wollen das nicht mehr hören, wir wollen den ganzen Scheiß nicht mehr mitmachen und keiner benutzt eine Maske. Ich habe nur ergänzt, das ist genau das, was ich auch gesehen habe, und ich war in 4 Staaten unterwegs, genau das Gleiche. Die Leute interessieren sich nicht, machen so gerade noch notgedrungen mit, aber sie sind eigentlich... So that's probably what may solve the problem, that people are getting sick and tired of all this without seeing any reality behind this, right?
Right. Well, and none of this is legal, by the way. If it's really challenged in the right way, it's not legal. And so that's part of the problem with the lawsuits. And again, I likened it with all these lawsuits, swatting at flies while the kitchen door is still open. You got to get much smarter about it. So the first thing is that in the United States, you have to be somewhat mindful of where you file a lawsuit. The jurisdiction counts. And the second thing is you have to tailor your argument to something that's interesting to the courts and that doesn't and that bypasses this business of the government doesn't have to respond because it's an emergency. You have to bypass that, because what happens is they continue to walk in. Just look at a busy judge. Somebody says we shouldn't have to wear a mask, and it's against our civil rights. And then the health department comes in, and the governor sends somebody in, the emperor sends somebody in to say, well, it's a health emergency. Everybody has to wear a mask. And the judge doesn't want to err on the side of, if something really is going on, so says, yeah, we'll just uphold the order. So you've got to bypass their ability to come in and claim health emergency by challenging that there is health emergency in a way. So we've looked at, at the last time I checked, there were like 4,000 or 5,000 lawsuits that have been filed. I've reviewed a few hundred of them. Some lawyers I know have reviewed them, and we kind of know why they're not succeeding. Some are succeeding, by the way, but we know why some of the ones that aren't succeeding aren't, and we think that we can develop strategies to get around that in the future. In the future, I mean by this month.
This is just what you spoke about yesterday, that we should have a monitoring of the law cases that we observed. We should find out how many people are claiming it, are going to court, how many people are punished, and who does it, and have such a card of Germany where the courts are acting in this way and acting in another way. So to find a strategy how to fight this, I think we should observe this much closer.
Right. And what we've done is on our website, makeamericans.freeagain.com, we're tackling, what we're doing is building a voting block that at some point in time might just be able to make this go away. You have to deal with this from a number of different standpoints. We have a legal resource center where I've got a couple of people who just post every lawsuit we can find, and they're categorized by masks and state and all that sort of thing, so that if you're in some state like Nebraska and you want to file a lawsuit, you can go to our website and you can pick off complaints and make your own complaint that way. And then we built what's that? It's
a very good idea. We should just copy it.
Right. And then we also built, because the I don't know what you guys can do about this, but the school issue is huge. So we built a homeschool resource center, and we even have private counseling for people, all kinds of, we do conference calls every week helping people get their children out of school and school at home, homeschooling. And right now it's estimated that 40% at the beginning of when enrollment started, 40% of people were not going to send their kids to school, not worried about the virus, worried about the environment at school. That number is going up. And what that's going to do, which we're kind of excited about, is it's really going to eviscerate public education in the United States, which needed a bunch of changes. I mean, we've been talking about education reform in our country for decades. Nothing's happened. It gets worse every year. Well, I'll tell you what, take most of the kids out of school and the parents basically say, you're doing something different or I'm not putting them back in. And we'll see reform that took decades, nothing happened. It'll happen in 6 months. Okay. So again, I'm all about power to the people. If we do this, if we act, really, what they've done is they've managed to get a handful of government employees and governments to act in lockstep, right? If about 7 billion people around the world do the same thing, there's a whole lot more of us than there are of them, and this would be over with very quickly. And that's what they need to see. This needs to be something that never happens again, because the people who did it are disciplined and criminally convicted, and also because so much effort yielded them nothing. That's my goal. At the end of the day, these people who did this are going to sit around and go, how the heck could this have gone wrong? We were so rich and powerful and so smart, and some little girl from Columbus, Ohio, and a few friends made this all go away. Well, that's exactly what's going to happen. So if you're watching this, you know, get ready to retreat to your cave, wherever it is that you're going to go to when this is over, because it is going to be over and we're going to win.
Ja, sie ist sehr optimistisch und sagt, wenn sich nur die Leute richtig konzentrieren und die Lawsuits suchen, die passen, und zwar in den Gegenden, wo man weiß, da ist das Gericht eher aufgeschlossen, als in den Gegenden seine Energie zu verschwenden, wo man weiß, da hört keiner zu, dann wird das funktionieren. Sie sagt, wenn 7 Milliarden Leute, das ist vielleicht ein bisschen optimistisch, aber wenn jedenfalls sehr viele Leute diesen Druck ausüben, dann wird das Ganze in sich zusammenfallen und dann werden die Leute am Ende bezahlen. Sie sagt, die werden bezahlen, die müssen in den Knast und sie müssen diszipliniert werden. Ich kann das jetzt nicht genau übersetzen, weil mir das Wort gerade mal nicht einfällt, aber müssen also auch verwaltungsrechtlich bestraft werden. So what do you think, how much longer is this going to take? Are we about to reach the tipping point?
I think so. I think it's not going to go away really fast. You know, and I think everybody just would like for it to be gone tomorrow. But I think, first of all, a lot of it in our country is election. It's about the election. So I think a lot of it will die down in November on its own. Mm-hmm. But I think that there will be some cataclysmic things that happen between now and November that will cause massive numbers of people to be able to regain some of their freedoms. And some of it will be, I think there's a gradual losing of interest. In other words, I remember when everybody used to watch the governor's press conference every day. Mm-hmm. Now people don't care. So whatever he says, it somewhat doesn't matter if nobody hears it, right? Mm-hmm. And you know, sooner or later, people are going to stop wanting to wear a mask when it's 100 degrees in the shade. And I'm going into places where they're taking the mask down. They're tired of trying to talk through it, and you know, just a gradual eroding of obeying. And then what's going to happen is either the despots are going to have to get really militant, like they're going to have to kill people and make them disappear and all that kind of stuff. Maybe they'll try to do that, but I think instead it'll just be they're gradually losing control right now. That will continue, and some lawsuits will also help speed up that process. Mm-hmm.
Well, in that sense, the American people are probably much more. Well, Germans are very easy to persuade to do something. They're much more obedient than the Americans are. But I agree with you. This is probably what's going to happen. Give me 1 second. Also sie sagt, es wird wahrscheinlich von selbst alles jetzt sich erledigen. Wir sind an einem Tipping Point angekommen. Was ich vergessen habe zu sagen, ist, sie hat so ein Legal Research Center eingerichtet, was auch Wolfgang Wodak sehr gut findet. Da kann man Klageformulare, Widerspruchsformulare runterladen und dann für sich selbst benutzen. Sie hat aber auch ein Homeschooling Research Center eingerichtet und da sagt sie, ist inzwischen die Rate derjenigen, die ihre Kinder nicht wegen Corona, sondern wegen der Maßnahmen nicht in die Schule schicken wollen, bei 40%. So did I get that correctly, that 40% of the people who are supposed to send their children back to school are not going to do it, not because of the coronavirus, but because of the environment that they're
Yeah.
Okay.
Yeah. And there are going to be more. We predict that there will be two waves. The first wave we're experiencing right now, which is school starts in a couple of weeks. We don't want to send our kids. And we started seeing that back in early July when we launched our homeschool resource center. Lots and lots of parents using these resources to get their kids out of school. We've already seen in places where the schools have already gone back into holding classes that people are saying, this is just a terrible environment. I mean, my kid's not happy. Or they close the school again. You go to school for a week and then it's closed again. You know, people can't deal with that. Kids don't like that kind of uncertainty. It's not healthy for them. So I think after school starts, we'll see even more people doing it. And I think that's good. You know, the good things that will come out of this, in my opinion, are that, first of all, our medical system here in the United States, and I think it's the same way to a certain degree in most countries, our medical system was horrific and it was collapsing. Now it's collapsed and it needs to be rebuilt. That's going to be good. Public education going downhill has been for a long time. It's going to be remade. That's good. I think that recognizing the overreach of government, a lot of attention is going to be paid to that. That's a good thing to fix. And I think that the media, when this all is said and done, the very dutiful soldiers of the media who reported the stupid story that was completely implausible every day are going to be incredibly embarrassed. They're going to be essentially irrelevant to a certain extent, to a large part of the population. I mean, the sheep will still watch them, but they're not going to have credibility anymore. And we'll maybe see a rebuilding of the media. So I think a lot of good things can come out of this, as painful as it is. I think that the rebuilding and the lawsuits will be going on when I die. I think that's how much work there is to do. I'm planning to live to be 100, but this is so huge that I'm sure 30 or 40 years from now, the rebuilding and the lawsuits will still be going on.
Also sehr interessant. Sie sagt, die Veränderungen sind auch positiv. Also das ist das Positive, was aus dieser Corona-Krise rauskommen kann. Das Schulsystem war schon die ganze Zeit, das öffentliche Schulsystem war schon die ganze Zeit kaputt. Das wird jetzt wohl neu aufgebaut werden müssen. Das Gesundheitssystem war erst recht kaputt, wird auch neu aufgebaut werden müssen. Und sie geht davon aus, dass das, was an Rechtsstreiten passiert, sie sagt also, wahrscheinlich werde ich 100 werden, aber das wird sie nicht mehr erleben, bis diese Rechtsstreite vorbei sind. Eine Menge Leute werden hier offenbar dann sehr viel zahlen müssen, sowohl geldlich als auch in anderer Weise.
Okay, I have two questions. One is, what you said, that it's so different by state, that there are a lot of sick people or infected people, or that there are issues going on with regards to corona. So, which is a discrepancy for people to see in your face that it's different by each of the states in America. That is, maybe you could give us a little bit more information about that and also I'm interested to learn a bit more about the issue of the treatment. Because in the beginning, all this, with these ventilators and the big hype about it, and then it turns out in the end that this was not such a good way to treat people to begin with. Maybe could you elaborate a little bit on that?
Yeah, so what happened here with the states, we have 50 states, and some states didn't lock down at all, virtually no restrictions. They were much like Sweden. Some states were draconian and still are. And some of it's laughable. I mean, in California and New York, the restaurants have their tables in the street. And then in order to sit at the table, you have to order enough food to be considered a meal. So they actually put out public service announcements about you can't just have French fries. You have to order more than that. So it's a meal. So they've got the meal patrol people walking around to make sure there's enough food on your plate to allow you to sit there. It's crazy. All right, so the bottom line is that there's really differences in states in terms of enforcement and differences in terms of deaths. The death rate's been flat for a long time. It's all about cases now. And the number of cases is all about how many people you have knocking on doors testing people with the fake test, right? And how much fear you can gin up to. And the hospitalized patients, by the way, this is something I need to tell you too. In the United States, if you were not able to have your knee replaced in March because we had a health crisis, well, now you're getting your knee replaced. So you have to be tested in order to go to the hospital. And if you're positive, you are coded as a hospitalized COVID patient, not a knee replacement patient. Okay. So that's how they're ginning up the hospitalizations, and there's a financial incentive to do it. They get paid like $50,000 per person more if they code them as COVID. And by the way, the governors of the various states like to keep the crisis going because they get more money if it's a crisis than if they say the crisis is over. So this is all about everything but health. In terms of the treatment has always been, from the very beginning, people have been saying hydroxychloroquine, along with zinc and azithromycin, very inexpensive drugs available over the counter in many countries, are effective for both treating and preventing. Well, if you've got a $13, the drug costs $13 US and a couple of supplements that can prevent and treat it, well, then we don't need to lock everybody down. And we certainly don't need a vaccine from the Gates family, right? So that's why that all has to be hushed up. And you can tell what's going on by virtue of the fact that you would think that everybody in politics would say, oh my gosh, isn't this fabulous? A cheap drug prevents and cures this. Wouldn't you think that that's what people would say? No, we got to hide that information. Those people are crazy. The day after that press conference in front of the Supreme Court building, our emperor banned the use of hydroxychloroquine in Ohio. Okay, it's an inexpensive drug that works, and the criminal in charge of our state bans it. So, that will be a series of lawsuits too, because if people died who could have been saved by actually died from COVID, if we could ever figure out who actually died from COVID, but if they actually died from COVID and they weren't given hydroxychloroquine and it might have saved them, then the families have, that's another grounds for personal liability on behalf of the criminals running our government who allowed that to happen or made that happen.
Die Frage der Kollegin war, es gibt da ja unterschiedliche Herangehensweisen in den einzelnen Staaten. Was ist da passiert und was ist mit den Leuten, die dann beatmet wurden, die man ja später festgestellt hat, die Beatmungen waren wohl eher kontraproduktiv und haben zu vielen Todesfällen geführt. Dr. Popper sagt, dass es in der Tat unterschiedliche Herangehensweisen gibt. In einigen Staaten hat man es so gemacht wie in Schweden und gar nichts gemacht oder mehr oder weniger gar nichts. In anderen Staaten, wie zum Beispiel in den beiden Staaten New York und California, gab es sehr strenge Lockdowns. Heute noch, das habe ich erlebt, als ich zurückgeflogen bin, kann man zwar draußen essen in den Restaurants, aber da läuft inzwischen so eine Art Gesinnungspolizei oder Essenspolizei rum und sagt, das sind nur French Fries, das ist zu wenig, du musst da ein richtiges Meal haben, sonst darfst du hier nicht essen, sonst musst du ja wieder eine Maske aufziehen. Jedenfalls ist die Herangehensweise in den Staaten nicht entscheidend gewesen für die Konsequenzen. Überall gab es die gleichen Mortality Rates. Im Übrigen the mortality rates have been going down for a long time, right?
Right.
Yeah.
Exactly. Well, and who even knows what the mortality rates are?
Because nobody really knows who's dying off or with COVID, right?
No, and I'll just give you an example that in some states, first of all, the CDC is recording probable deaths and confirmed deaths and probable cases and confirmed cases, and all the states are reporting differently. So it's a gobbledygook mess of data that makes no sense at all. We'll be decades sorting all that out. But the Emperor of Washington State, this is kind of an interesting story. In some states, somebody gets an inkling that the numbers are inflated. And at one of the press conferences, a curious reporter who they always get thrown out if they ask questions. If you actually have a reporter in the press who asks difficult questions, they will be removed. That's another way that they've controlled the narrative. You wonder why this doesn't get out, right? Well, anyway, a reporter who was then banned from the press corps asked the Emperor Inslee about the inflated death rates. And he's like a child. I think he wears diapers, all right? Because what he said in response is, this is nothing but a conspiracy plot from the planet of Pluto. That's what he responded. Okay. Well, actually, as it turned out, really it was not a conspiracy plot from the planet of Pluto, because when somebody actually started digging into it, they had inflated their deaths by like 50%. Oh. And of course, the deaths are the thing that scare people the most. So if you can gin up the death rate, that really can make a lot of sheep very compliant, right? So in every state, this has been done. In the state of Colorado, people started getting letters from nursing homes saying your mother, grandmother, whoever was in the nursing home died of something else, but the death certificate was changed to reflect coronavirus, and we thought that you should know that the death certificate was forged. Well, a bunch of these people started calling their elected officials in the legislature, who then started, one guy said, well, I think that the health director should be criminally indicted for allowing this to happen. And then all of a sudden they adjusted all the data. So in every place where pressure has been put on the person collecting the data to true it up, the death rate falls by a lot. So even if you look at the death rate in the United States, and by the way, the death rate from pneumonia has gone down, 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 the death rate from corona up, up, up. So we know that some of those are being miscategorized as COVID deaths, right? But even that, if you look at the death rate, assuming they're inflated numbers, it's still no reason to lock the country down and do the things that they've done.
Wenn man sich also die Todeszahlen wirklich anguckt, die Mortalitätsrate anguckt, dann stellt man immer dann, wenn jemand Druck ausübt, fest, dass die Zahlen nicht richtig sind. Ein Beispiel ist im Staat Washington, also in der Westküste. Da gibt es einen Gouverneur, der gefragt wurde von einem Journalisten, hier, wir haben Hinweise darauf, dass die Todeszahlen nicht stimmen. Daraufhin hat der geantwortet, das ist eine reine Verschwörungstheorie vom Planet Pluto. Hinterher hat aber wegen dieses Drucks zwar der Journalist seinen Job verloren, aber jemand festgestellt, man hat reingeguckt, hat festgestellt, 50% zu hoch. Und so sei das in sehr vielen Staaten gewesen. Sie hat ein Beispiel genannt, wo auch aufgeflogen ist, dass eine Verwandte, die im Krankenhaus gestorben ist, nicht, anders als angegeben, nicht an Covid-19 gestorben ist, sondern an irgendwas anderem. Das ist aber nur deshalb rausgekommen, weil sie zwar offiziell so gelabelt war, aber irgendjemand im Krankenhaus hat den Patienten, hat den Angehörigen Bescheid gesagt. So this is a real mess.
Yeah. It's of epic proportion.
Yeah.
Of epic proportion. I never thought in my lifetime I would see something like this.
Yeah.
And,
sorry. Is it true that there are incentives for hospitals and for medical care wards to say it is a COVID-19 tent? Do they get more money for COVID-19? Is this right? By Medicare or by others?
Yes, it is right. And I just watched, it's interesting you should bring that up, because this is one of those things that's been, people say, oh, you're a conspiracy theorist. But yesterday, there were hearings held in our Congress, and the CDC, the head of the CDC admitted that there's a financial incentive to forge the data. And so this is well known. And any time you attach a financial incentive to do the wrong thing, I mean, that's part of the problem. In medicine, again, we're just seeing a bigger version of what's always been going on. In medicine, we have always paid people to stay busy, not based on the result, okay? And so if you accept that behavior for a long time, now you pave the way to accept behavior that you can incentivize people to do the wrong thing, even forge deaths and cases, because there's a lot of money involved.
Dr. Wodak hat eben gefragt, ob es wahr ist, dass, was sie schon ein paar Mal jetzt erwähnt hat, dass jemand, der als Corona-positiv getestet wird, der Gesundheitsindustrie mehr Geld einbringt. Da hat sie gesagt, ja, das ist so. Dann in dem Moment, wo jemand Corona-positiv wird einfach mehr Geld an den Arzt oder an die Klinik bezahlt. Das sei aber schon sehr lange so, dass für bestimmte Verhaltensweisen, medizinische Verhaltensweisen, wenn man dafür mehr Geld wird, dann kriegt dann diese Verhaltensweisen auch tatsächlich mehr genutzt werden. Ob das so richtig ist, da hat sie ihre großen Zweifel dran. Ja.
I have one more question from Italy, from Italian doctors. We learned that there seemed to have come from the government some kind of instruction how the people should be treated. You know, and it was like with cortisone, with paracetamol, and, you know, sort of like a proper instruction that all the doctors followed. And now it seems that some people in Italy are filing lawsuits also for mistreatment, because it was like this super strict plan that went ahead without sort of looking for other remedies, like, I don't know, like working with the immune system. And I was wondering if there was such a
are there any guidelines, medical guidelines that are similar to this?
Well, I think that's the problem. You know, we have degenerated, and I suspect that this is going on all over the world, to the place where the judgment of a physician, in conjunction with the evaluation of the patient, has become irrelevant. And that's a bad thing. I mean, I think that in this rebuilding of medicine, we're going to see these huge medical institutions disbanded, hopefully. People walking out and saying, I'm not practicing this way anymore. I'm going to go on my own. I'm going to set up a family practice. When I was a kid, our doctor, who I remember, based on all the things that I say about the health professions now, you might think I don't like doctors, but I remember our family doctor when I was a child. We liked him. We trusted him. Okay, he took care of my sister and I. He took care of my mother, my father, my grandparents, my aunt, my uncle, their 5 children, my cousins. And he was a family doctor, and we trusted him, and he knew our family, all right? That's all been taken away. Now it's all institutionalized. Everybody's supposed to follow the playbook. If the person has COVID, you do this. If they have something else, you do that. You adhere to the community standard, and if you don't, you're going to get sued, or you could lose your license. This is terrible. This is terrible. And there are 2 issues with it. One, it treats people like they're units of humans instead of individual humans. But the other thing is it totally takes the power away from the doctor. And it also attracts a type of person. I mean, I don't know what type of person wants to go into medicine today to be part of this mess that we're talking about. What kind of person do you have to be to want to do this at this point? Yeah, and so we're attracting the worst possible people. They might be really smart here, but there's more than just being smart to being a good physician. Yeah. And we've got to start looking at that, you know.
Du hast eben gefragt, es gab bestimmte Richtlinien. By the way, this is not to say that the doctors really made mistakes, because as it turns out, we spoke to some of the doctors, we spoke to some of the medical practitioners and professors of medicine from Italy, and they said, we're not blaming any of the doctors, because they followed orders. They didn't realize they were doing the wrong thing.
The problem is the system. Yeah. The problem is the system. And here's what happens. We have set up a system that is terrible. And you probably have heard, I don't know if you have this saying in Germany, but a bad barrel. All right, bad apples in a bad barrel. So so what happens is you get a few good people who get thrown into a bad barrel, and what generally will happen is the bad apples will turn the good ones bad, not the good ones convert the bad ones to be good, right? And so what we have created is a system that is ripe for abuse, and the system has to be changed. That's one of the things that we're going to have to deal with as we rebuild after this mess is over, is making sure that it can never happen again. And part of that is decentralizing medicine, getting it back into the communities, getting people back in charge of their own practices and able to do what they want. That's what we have to promote. And I get emails every day from doctors and nurses and nurse practitioners who are just disgusted with all of this. And I tell them, what you need to do is take that disgust and take the risk and go out on your own. I did it. Look, I came out okay. All right. You can do it too. We'll help. That's another thing. I have a lot of plans for helping rebuild after we get past this mess here. We'll help doctors and nurse practitioners set up practices. We're going to help businesses come back to life here. I mean, a lot of work to do.
Okay. So. Sie sagt, auf die Frage, ob da in den USA auch ähnliche Herangehensweisen gehen, ist sie auf das große Ganze, auf das System eingegangen. Sie sagt, das ganze System ist kaputt, weil anders als aus ihrer Kindheit es ihr noch bekannt ist, die eigentlichen Mediziner, die Ärzte, die Familienärzte, die gibt es nicht mehr. Also die sich persönlich um die Patienten gekümmert haben, um ihre Schwester, um ihre Großeltern, wo man Vertrauen hatte, wo man wusste, die kennen einen, die gibt es so nicht mehr, sondern das Ganze ist ersetzt worden durch eine medizinische Industrie, die eine einheitliche, automatische oder robotische, kann man vielleicht sagen, Herangehensweise haben. Sie fragt sich auch, welche Persönlichkeit muss man haben, um heute noch in diese Medizin zu gehen. Sie selbst ist ausgestiegen und macht ihr eigenes Ding und hat große Pläne, will anderen helfen, auch wieder zurückzukommen zu dieser persönlichen Medizin, wenn das Ganze durch ist. So you would support the old-fashioned system of having personalized medicine rather than have this medical, this robotic and one-size-fits-all approach, right?
Well, it isn't working, and I think we have to stop doing things that aren't working.
Yeah.
And I think nobody likes it. You know, my business has thrived for 25 years because we attract people who are unhappy with the medical system. People don't like it. And it's the same as schools, you know, that this idea that I don't like it, but I have to do it anyway. I don't like the schools. I don't like the education my kids are getting, but that's where I have to send my kids. And I don't like medicine, but that's where I have to go. We have to end that. This is ridiculous. It is ridiculous. Okay, 330 million people in the United States of America need to stand up and say, we're not doing it anymore. We're not doing stuff we don't want to do. All right? We make these people irrelevant. And I think that we were heading in that direction at a snail's pace before this. This is our opportunity for a reset. Just refuse. And that is going on, by the way. The medical, again, people are not taking their kids for their children. I've never understood this, why people take healthy children to hang out with doctors anyway. It's kind of, I don't get that. But anyway, people aren't taking their kids in for the healthy child visit with all those vaccinations and everything else. And at a certain point in time, the habit will have been changed. Instead of every 6 months we take them in, it's going to be, well, we went 2 years without taking them in. Let's just quit that, right? And then it'll be that they're going to have to fight to get people back. And I think that they don't realize how hard that's going to be. So again, we're in a mess, and the criminals are still in control. I'm not delusional here. I'm just saying I look at things. I built my business on looking at the future and what was going to happen. I turned out to be pretty right in terms of appetite for what we do. And I'm looking out there and I'm watching this whole thing happen, and I'm thinking, I don't think that they're opening up champagne at night and testing themselves and saying, we got it covered. I don't think that's what's going on at all. I think that they're a little concerned, and they have good reason to be.
Sie ist sehr hoffnungsvoll, dass auch das, diese medizinische Maschinerie, so kann man es vielleicht sagen, ein Breaking Point erreicht hat, dass immer mehr Menschen einfach keine Lust mehr haben, sowohl als Ärzte daran teilzunehmen, als auch als Patienten oder potenzielle Patienten sich da einzugliedern. Erstens ist es sehr teuer und zweitens ist es eben wahrscheinlich nicht der richtige Ansatz. Und sie ist sehr optimistisch, dass das jetzt auch ein Katalysator, die Corona-Krise, so the Corona crisis could be a catalyzer for progress in a bunch of different fields, practically for everything that's been going wrong and reached its breaking point in the meantime.
Absolutely. I've never been more excited in my life than I am right now. I mean, and that's either I'm completely insane.
Well, you've been doing the right thing for the past 25 years, obviously.
Or I'm right. And I'll tell you why. Not to sound arrogant, but I put out my first video the first week in March. I was right about all of it. Okay. I've been right about where medicine was going. You can go back and read. I've created a massive amount of material. I think there are 2,000 videos posted now with me. And you can go back and look at what I've been saying. And it's all been spot on. It's all been showing that we're careening toward exactly this crisis that we're having now. So I think we have to look at this from a positive standpoint. You can drive yourself crazy and feel like just, laying on the couch if you don't think of it in more positive terms. But I actually think we have a great opportunity here. We have to deal with the crisis at hand. It's really important that we stay focused. But once we get past the crisis, then we can start really thinking about rebuilding in a constructive way. And we'll look back one day and say, this was a heck of a way to get here, but we got here, and where we are now is good. And so let's look at it that way.
Sie ist sehr optimistisch und sagt, dass gerade diese Krise für sie der Punkt ist, an dem man sich festhalten kann und sagen kann, das ist der Moment, der ist zwar schwierig, aber wir halten das durch und dann, wenn wir da wieder rauskommen, werden all die Dinge geändert, die eigentlich schon längst hätten geändert werden müssen. Sie sagt, sie hatte von Anfang an recht, ist da sehr klar, weil sie hat die ersten Videos im März gemacht über das Gesundheitssystem und jetzt habe sich herausgestellt, so ist es tatsächlich, so ist es jetzt auch gekommen, das Gesundheitssystem ist mehr oder weniger kollabiert, aber sie guckt nach vorne und sieht das Ganze in einem positiven Weg. Now that is, well, thank you for taking the time. That was a real pleasure.
Amazing. Thanks so much.
And thank you for being so outspoken.
Thank you.
We hope we can
Thank you. And we'll all stay in touch, right?
Yeah, we will.
Right.
Take it easy and take care.
Yeah, take care.
All right, you too.
Yeah.
Bye-bye.
Bye-bye.
Bye.
So,
Ja, das
Herr
ist
Wodak, was sagen Sie dazu? Ist das eine Einschätzung, mit der man sich anfreunden kann? Ist es zu optimistisch? Ist es zu pessimistisch? Macht es Sinn oder wie sehen Sie das?
Also ich glaube, das macht sehr viel, mir hat das sehr viel Hoffnung gemacht und die Zuversicht, die Sie ausstrahlt,
Ja.
die teile ich. Ich denke, die Menschen sind unzufrieden. Sie sind unzufrieden mit unserem Gesundheitssystem. Die Leute, die im Gesundheitssystem arbeiten, in den Krankenhäusern, die sind ja gerade dabei gewesen, schon die Monate zuvor, sich über die Fallpauschalen, über die Industrialisierung der Medizin Gedanken zu machen. Dass die Menschen keine Termine mehr kriegen, dass die Medizin hinterm Geld her ist und für das Falsche bezahlt wird, dass man der Pharmaindustrie nicht mehr glauben kann. Das ist eigentlich Allgemeingut. Und das, was wir jetzt erleben, das spitzt die Sache zu. Und es ist wirklich eine Chance, dass wir uns dann überlegen, so wie muss es denn in Zukunft aussehen, damit man denen wieder vertrauen kann, denen wir diese Gesundheitspflege anvertraut haben, damit das wieder transparenter wird. Und das ist die Idee jetzt, da habe ich auch in der Politik sehr, sehr viel mehr positives Echo bekommen, dass man die gesundheitliche Basisversorgung, also das, was jeder braucht, jede Familie braucht, was man braucht, ein paar Mal im Jahr vielleicht, dass das wieder in die Kommune zurückkommt, dass die Pflege in die Kommune zurückkommt, dass es nicht Aktiengesellschaften geben darf, wo man die Pflege dann mit Pflege spekuliert, mit der Pflegebedürftigkeit. Das sind perverse Entwicklungen, die wir haben. Und ich denke, dass die Kommunalisierung der medizinischen und pflegerischen Grundversorgung ein ganz wichtiges politisches Thema ist, um das Vertrauen in diese ganzen Strukturen wieder aufzubauen. Das wird auch bei uns kommen.
Also aus meiner Sicht ist das eine sehr amerikanische Sichtweise, diese positive Herangehensweise, immer schon mein Ding gewesen, deswegen leben wir da ja auch überwiegend. Aber ich glaube auch, dass das bei uns auch ziehen könnte. Jetzt haben wir aber schon wieder einen neuen Gast.